12 months after the beginning of the COVID-19 pandemic, while most of us were stuck to our news feeds looking for answers, governments were busy looking for solutions. Research teams from around the world had developed the first vaccines to fight the COVID-19 virus. In the past, humanity has always relied on vaccines to bring down the mortality rate of infectious diseases. And this time, it is no different. Hello and welcome. You're with me, Narengwa Fiana Mothoni. In this particular episode of Doing Business in Rwanda, we bring you the latest on the vaccination program here in Rwanda. From receiving the vaccines at the airport to administering them at the health facilities, all from ground zero. After the arrival of almost 340,000 COVID-19 vaccination doses in Rwanda, the Ministry of Health immediately embarked on the distribution, managing to deliver the vaccines to health facilities in all 4 provinces of the country.
So when you have vaccines, you don't want to wait. That's the most important principle that we had as a program, as a country, as a government. We don't want to have doses sitting in the fridges when people could get the virus anytime out there. And that's why one night the vaccines landed at the airport, and then a day after we started to distribute across the districts of the country. And as of today, we actually almost utilized all the vaccines we had acquired. As of this morning, we've reached almost half, a quarter of a million, 250,000 people vaccinated for their first dose. So we expected a few more people to be vaccinated next few days, just to finish all the doses we have.
The administration of the vaccine is on its way, and we spoke to a range of freshly vaccinated citizens to learn about their respective experiences. As part of the vaccination rollout, there are certain groups of people that have been prioritized. We started vaccinating people who are most vulnerable, and now we are vaccinating the market vendors who, in a day, get to meet with many people. Even looking at the environment in which they work in, it's many times crowded and it can be easy to transmit the virus.
After I received my first jab of the vaccine, I feel okay. I have confidence that with time, I will be able to protect the people around me. I will sensitize everyone to try their best and get vaccinated so that they feel safe in any environment. After today, I will carry out my business better since I won't have any fears of getting infected or passing on the virus to other people. I thank the government for thinking of us and bringing the vaccine, especially since many of us wouldn't have been able to afford the vaccine. They made it easy for us.
I have been vaccinated and I haven't felt any side effects yet. I work at the market and I know it is an environment where people can easily get infected. I am now happy that after some time, I will be able to be safe and protect people I get in contact with. Before, I used to see clients and I would get scared. The thought of getting infected impacted how I did my business, but now it will no longer be the case. I thank the government for thinking of us.
I have been vaccinated and I feel good. Vaccination is important, especially in our line of work. I am confident and trust that the government will not bring us something that would harm us. They have given us the tool to protect ourselves.
Yeah, I took vaccine, and it's not the first time I take a vaccine. I took other vaccines since I was a child, but it doesn't feel different with other vaccines. But you can get some feeling of a pain somewhere on the site of injection. You can feel like a slight fatigue. You just don't need to overwork after you get a vaccine a day after. For some people, they don't feel anything. I didn't really have problems with my post-injection, but some people may have different type of reactions.
To bring this pandemic to an end, a large share of the world needs to be immune to the virus. Until then, those who have been immunized must follow the guidelines laid out by experts.
People are aware that being vaccinated doesn't mean that you need to remove, or you are no longer, you don't need to comply again with preventive measures. You should still comply with your preventive measures until we reach a health coverage of at least beyond 60%, starting beyond 60% and above.
Nations world over are dealing with the possibility of a vaccine shortage coupled with the uncertainty of its efficiency and suspected side effects. Leaders here in Rwanda are cognizant of these reports and are approaching the matter with great caution.
We've had time to look into different claims about the side effects, the reports that were coming out in this week. So even check with a scientific advisory group on what does this mean. When you look at the title of this country has suspended the vaccination, you would say, oh, this is terrible. But when you go into details, what exactly has been reported? So it started with one country reporting a case of someone who died in Austria, and that person had a thromboembolic event 10 days after getting vaccinated. Then another case happened in Italy, another case in Denmark. Then because they had received the same batch of the vaccine, AstraZeneca vaccine, the particular batch of the vaccine, they took precautions to not continue until they find out exactly what happened with each case. And those are a few cases that happened in those countries. It doesn't mean that they stopped the entire AstraZeneca vaccination program in their context, but that particular batch. And it's not new. Whenever we see a problem with medicine, with vaccines, it's normal to pause and check that batch. Could be one batch, could be a big shipment, but we don't have the same batch. That is one. Number two, there are other countries who also went far and assessed the people they had vaccinated earlier. The first country was UK. UK had vaccinated more than 11 million people and checked if there are similar effects of thromboembolic cases had happened in UK and linked to the vaccine, and they found none. So the confirmation we have, or the evidence we have from all different research activities that are happening, is that AstraZeneca's vaccine is not linked to thromboembolic event that was reported in Austria, in Italy, and in Denmark. The other factor is that you could have cases, someone could die after a vaccine, but not necessarily linked to a vaccine. Because in any way, if there was no vaccine, another event, another disease can kill someone. So it's important to confirm or to check if there's no relationship. Because if you manufacture a vaccine, you never know exactly what will happen to different people, because many studies have been conducted in only 40,000, 50,000 people. So that is important to keep this global monitoring of any single case. And pausing a bit is not new. It has happened for other vaccines, even on AstraZeneca itself and other vaccines, to check if there's no link. But so far, as a country rolling out AstraZeneca, we are not worried about that. We are not stopping using AstraZeneca because there's no evidence that it's harmful. It's a good vaccine. It's working. Has been used in 70 countries. They're still using it. We are using it, and we continue. If any science evolves, if any new evidence comes, we will adapt our implementations.
As per the World Health Organization, 600 million doses has been reserved for the continent of Africa, which covers only 20% of the continent's population, to ease the burden on the government, expecting assistance from the private sector in the procurement and this mass-manufactured yet rare vaccine does not seem unlikely.
There is no restriction. The restriction is the fact that there is no availability of sufficient vaccine on the market. That is true. You trust me. Number two, but in terms of regulations, we are there. We are open. We have systems. Those people, they used to be in the country procuring drugs, so they know how it works. So they will fill all documentation required, and if they can bring it, we'll go through the dossier. If we are sure that while they are getting vaccine, these vaccines are reliable, because we need to avoid fake product. As we are doing for the rest of drugs, we need to avoid that someone is coming with a fake vaccine and it will affect completely our the epidemiology mechanism that we are setting so that we can control the transmission of the virus.
The plan for us was actually to vaccinate millions of people. We want to reach up to 70% of the population by next year. But the most important phase is to reach 20% of everyone that is needed to get this vaccine reached as soon as possible, which is close to 3 million doses that are required. We don't have exact time. We're just pushing and monitoring as much as we can. We have different people who are helping us to get the doses quickly before the time for the second dose is for those who received the first, but also for others who have not yet received any dose. So we have some expected dates, but previously we've been saying it's coming this date, and we had delays. That's why I'm saying we are not sure when, but what we're sure is that the vaccines are coming very soon.
Most African nations signed up for the COVAX program back in February 2021. Nations like Rwanda are focused on protecting its citizens and its economy from the deadly virus. That brings us to the end of today's episode of Doing Business in Rwanda. You're with me, Narengwa Fiona Muthoni.